Thank you, Dr. Manish Singh Azad, Dr. Shailendra Kumar Singh, Dr. Ram Singh Shah, and those who attend the session in this evening. Good evening, good afternoon, and good morning. This is the 2099th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SHAJI VARGHESE KUDITAT. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum is about to celebrate the 2100 day tomorrow. So there will be a special celebration on this tomorrow evening. So hope all of you can join and we can celebrate it in a big way. And our forum consists of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. And we have so far uploaded more than 3,750 videos. Hope all of you have seen some of them. And let me come to today's guest. Today's guest is none other than our Vice President, Dr. SHAJI VARGHESE KUDITAT. And Dr. SHAJI VARGHESE KUDITAT is an innovative and pioneering homeopathy physician and researcher who introduced a new science called dynamic science that Doctor has explained this methodology in a forum before. And dynamic science is a product of his sincere, dedicated effort to correct the limitations of the present science to make it more complete, to explain and understand the nature and behaviors of nature to its fullest extent. This new science helps us to understand and explain many things which the present science fails to explain, like how mind, vital force, soul, and DNA are interconnected, how cancer develops, how mutations happen, how in homeopathic medicine work, how spiritual healing takes place, and how yoga and medication can heal, and how natural erogenic aids work. Though in ancient cultures believe that mind, soul, body are interconnected, the scientific community does not explain how this relationship practically works. Dr. Shaji Kudiat, through his dynamic science, answers this mystery to the scientific world and humanity. It is a historic introduction which will change the future scientific thinking and understanding, and also the parameters of the future scientific science. This also will create a beginning of new scientific era called the dynamic scientific era, the man of many firsts. So he is the person first to introduce homeopathy in Philippines. He is the first to formulate DSA. He is the first to introduce DSA science in sports medicine. The first to introduce DSA as a natural aid sports, and the first to introduce genetic counseling, and the first to define what is healthy mind through dynamic, and the first to engage the scientific guided life coaching individuals, first to explain how homeopathy works in the, energy medicine and using scientific using dynamic science. At present, doctor is working in the Philippines, and you can contact doctor through his WhatsApp number, as well as his website, and everything is there in the poster. And doctor has so far presented some of the interesting and most scientific papers in this webinars. And today we'll be talking about understanding and managing cancer differently. So it's a very, very interesting and very big subject. So we proudly welcome you, sir, to this session.
Thank you, Dr. Danesh, and thank you all those who are listening. It is a privilege again to have with you this evening. I welcome all of you to this presentation. I will be speaking on a different way of understanding cancer. I am, as introduced, uh, I am introducing a new scientific hypothesis called dynamic science that explains how the mind, vital force, and DNA are interconnected. Essentially, it explains how the mind, soul, and body are interconnected. This explanation is very important to create a scientific basis for holistic systems of medicine. When we look into the different systems of medicine, other than conventional medicine, allopathic medicine, all other mainstream medicines, or traditional and alternative systems of medicines are holistic systems of medicine. Actually, the holistic systems of medicine should be the scientific basis for medicine itself. But unfortunately, the conventional medicine, the allopathic medicine, is looking at the physical plane alone. And that is the dominant scientific approach today. We call it linear science, where we look into the material perspective of the science alone. But in a living organism, more than the physical body remains alive only when the dynamic components are associated with the physical body. So these dynamic components plays major roles in understanding, influencing and impacting the physical functions. But these impact, influence in the health, in the disease development, and in the curative management of diseases are never identified, scientifically studied to be beneficial to the suffering humanity. And that is the biggest mistake happening in the world today in the scientific scenario, especially in the medical researches that need to be corrected the soonest possible time. So today I will be introducing understanding and managing cancer differently. As I told you, I have introduced this dynamic science. I have developed a methodology called dynamic scientific approach that connects the different parameters that create and maintain a living phenomena, that is the mind, vital force, and the physical plane together, and its interaction with the entire universe. So we need to look into the causes of maintenance of health, disease development from all these three areas, and also its interaction with the universe. So the universal impact also needed to be understood. Even astrology has a role in health, and but these things are never scientifically understood in the modern scientific perspective. So some people may consider these perspectives are unscientific or call different names when we speak about such a scenarios. But there is a science which we all need to understand the science, the medical science, particularly homeopathy in its full extent. So I will be not looking into the entire scenario today. I will be just looking into the cancer management through dynamic scientific approach. So there are this is mostly for a patient perspective to understand this uh, cancer management, what makes it different, what are the advantages of this method, and how it become beneficial to mankind. All these things I will be explaining because I am marketing it as the best, latest, and the safest methodology for cancer prevention, treatment, and rehabilitation. So I will share my presentation, which is usually given to my patients. So as an introduction to this methodology. So the title of this presentation is Introduction to DSA Treatment, Reversing Cancer Naturally. So as we know, the whole world is treating cancer today without understanding how cancer develops. Only if we know how cancer develops, then only we can design a treatment to reverse it or to cure it. So even the term cure is considered illegal. And in some countries, somebody, or even in the social media, if somebody say cancer is curable, even social media ban such statements. So because what conventional medicine believe and promote and propagate is the only scientific way for the world today, because they control and uh, they control the world, and especially in the scientific scenario and researches. So, but there are things that they need to understand, and the world need to understand the hypocrisy and the unscientificity happening in what they do. So, this is an effort to bring to the awareness of common man such things which the world need to understand. So our vision is to transform humanity and the scientific world from a materialistic or linear scientific perspective to a dynamic or holistic or non-linear scientific perspective, drawing upon the new science called dynamic science that scientifically explain how mind, vital force, and DNA or physical plane are interconnected. I'm not going to the details of these explanation, but I will be presenting mostly what are the advantages the patients will get and homeopathy will receive by understanding these perspectives. So the objective of this presentation is to explain what is wrong with the present cancer treatment, how DSA treatment will be able to reverse cancer, and the advantages and procedures of DSA treatment. These are the basics I will be presenting today. So the first thing is what is wrong with the conventional treatment. So the main thing is the whole designing of the current treatment is just targeted to destroy the tumor or remove the tumor without understanding how cancer actually develops. And that is the biggest drawback. They treat and they destroy tumors or tumor associated with the cancer through chemotherapy, radiation therapy, or remove it through surgery. Whatever way they destroy it or remove it, the tumor or cancer still comes back, and that is the difficulty that patient faces, because the root causes that produce the tumor from all possible dimensions are never identified nor corrected. So the treatment they give also give a lot of side effects. Chemotherapy weakens the immune system, and radiation, and also leading to easy advancement of the disease. Radiation therapy often causes tissue hardening, increases discomfort, and complications such as keloid formation happen. And the cancer most of the time recur and spread even after the treatment. So advantages of DSA includes there is no side effect because it is only incorporating a complete understanding of DNA regulation, and along with the tools without side effect and natural medicines like homeopathy, and which influence the three components, the mind, vital force, and the physical body, along with the natural diet. So this methodology explains how cancer develops, because the first thing we give to a patient is not medicine, but an explanation of how cancer develops. We call it a genetic counseling session. So the genetic counseling is the first thing we give, which is the most important medicine for reversal of cancer in our treatment. We also, this methodology also help in identifying and correcting the root causes from all possible dimensions. Through our researches, we identified that each organs, each systems are connected to each emotions. And that emotional development is the one regulating the vital force, and which in turn connected to our DNA. And such DNA modifications proportionately happens. So the reason for development of such emotions leading to cancer development will be different in different patients. So our duty as a physician is to identify the different scenarios exist with each patient. For example, a right breast cancer patient, there is a particular emotion and behavior connected to that right cancer development that lead to that condition. So that is permanent, but the scenario and the situations for each patient to develop that emotional state vary from person to person. So we need to analyze the condition and the environment that patient live with the concept and attitude of that patient and others, and need to identify it and bring to the awareness of the patient and others associated in the involved in the life of that patient, and make them live harmony with the nature. Because today there are forces that are corrupting our mind with unnatural philosophies, unhealthy philosophies and concepts and attitudes, whereby we are allowing to develop unnatural, unhealthy thoughts, which in fact superpose with our vital force and modify its frequency, whereby influencing our DNA and modifying it accordingly. So this corruption that happens in the world today are one of the main reasons for so many new and new diseases. This corruption happen in every way, not only in the mental, emotional perspective. They try to bring a disharmony to our vital force through unnatural radiations and Wi-Fi and different 5G, 6G and such influences, and also corrupting our physical body with the introduction of different ways of vaccines and polluting the environment, our food and the drinks we drink, every way they are trying to damage the healthy existence of humanity. It is a very important point we all should make note of to correct and to understand, so that we can take maximum precautions to avoid as much as possible. So even to take a good food, natural food, we need to get into agriculture, farming to get natural uh, food for ourselves. And in that area also, they are creating laws which force us to use their kind of technology, whereby we will be, these plants and animals also get corrupted. They are vaccinating all animals with mRNA vaccines without our knowledge, even misrepresenting us traditional vaccines. These are deception and cheating, and we need to, even the meat we eat, milk we drink, eggs we take, all these are corrupted with these kind of vaccines and their products. And even the milk, they are, the food items they are spreading and providing in the market through our government shops, and all these things are also corrupted with various toxins, telling us it is vitamins and this and that. Nobody knows the exact ingredients of it. So such a corrupted world we are living. So it is high time for us to understand, share it with our fellow human beings to understand this, so that something can be done, and we need to make our own food, everything, so that our healthy existence will be possible in this world today. And this DSA treatment increases the immunity and prevents the spread of cancer, and also stop progression of the cancer as we identify and rectify the root causes that produce the cancer. And this is homeopathic medicine based and dynamic science guided. One of the It is an integrated approach, not just an integration of different systems of medicine, but a judicious integration, understanding the different components that influence the life and the healthy existence, and a proportionate, judicious integration we are doing in the DSA approach. And it is applicable not only in prevention, treatment, but also in rehabilitation. And it is good for both the benign and malignant tumors. It is constructive than destructive. We don't appreciate and use chemotherapy or radiation therapy. As there is no chemo and radiation, there is no hair wall or interaction or thickening of the affected part. There will be judicious application of surgery to speed up the healing process. So we observe that when we apply homeopathic medicine, which increases and optimizes our immunity, anything that is functioning inimical to our system will be rejected from our system. You may have also noticed those who treat cancer patients with the homeopathic medicine. When we give the right medicine, if there is a breast cancer, the cancerous tissues will be killed, and an ulcer is formed to vent it out. So that is actually a positive phenomenon, preventing its internal spread. That indicates the strengthened immunity and rejection to the outside. So once the ulcer is formed, it will take a long time to heal. So their judicious application of surgery can shortcut the rejection of that enemy of the body from the body. So judicious application of surgery is highly effective in shortcutting that rejection and managing the malignancy in a shortcut manner. And our methodology is painless, non-invasive, side effect free, holistic, and natural. DSA is applicable not only to cancer but also to different types of complex and challenging diseases like autoimmune diseases, non-communicable diseases, lifestyle disorders, etc., for which there is no treatment is available with the conventional medicine today. This is slight modification of the homeopathic treatment we are doing. Only thing we are adding here is nothing but identification and rectification of the root causes, which Hahnemann mentioned as the fundamental causes. So that we all are supposed to do, but most of us are practically focusing only in prescribing the minimum or the correct medicine. If you identify and rectify the root causes or the fundamental causes from all possible dimensions and give the right medicine, that is appropriate way, and that is what Hahnemann envisioned to practice by every homeopathic doctors. So DSA methodology is actually that exact practicing of Hahnemann's method, including the rectification of the fundamental causes. So this methodology, when we do that, when we explain scientifically how cancer develops, this treatment not only help the patient in reversing the cancer, but also helping the whole family in understanding and preventing or removing the hereditary transmission and the hereditary tendency for the family members. And comparatively, it is less costly also. So the procedures include, we begin with a genetic counseling session for the patient and the family and the support group to understand how cancer develops. And that is with that clear understanding, we design our treatment, and it is always patient specific. So these understanding should be conveyed to the whole family and those who support the group, because in the common among the public today, cancer is considered as a very terrible, challenging problem. So homeopathy is considered not competent to do that in our society today. So an exact scientific explanation of why and how it happened will give credibility and trustworthiness to patient, and that is what we do with a clarity, and also bring clarity of mind, why and how we are managing it, and what is supposed to be the role of the doctor and the patient, and where are supposed to reach, and how the reversal become possible. So all these are clearly explained scientifically in our treatment at the beginning itself. And then we do the detailed case taking. This is all we all, as doctors, we all do it. But this presentation is actually for a patient orientation. So that's why I'm giving this for our homeopathy supporters to understand. Then we design the treatment after the detailed case taking, understanding the different scenarios exist with the patient and the environment, including the family environment the patient lives in, and where we do the root cause identification from all possible dimensions. Then we do the homeopathic repertorization, prescription, follow up with the continued counseling, consultation, meditation, and medication. So, how it can reverse the cancer. So, what lies beyond the current science explanation is, as we know, the limitation of the current science is that it limits to the physical body alone. And the discovery of dynamic science and dynamic scientific approach, I am not incorporating in this presentation. It is a little longer presentation. I am not intended to do it here today. So I'm not going to that. And cancer is not just a physical disease, but a manifestation of mind, body, and soul interconnectivity that leads to the genetic changes. So our DNA and our genes are regulated not only in the physical body, but it is mostly connected and controlled and regulated by our dynamic components. And dynamic science explains that how it functions, how it happens. And that explanation is a clarity and clear understanding. And today's world lacks that information. And that makes the DSA treatment a different in clarity and understanding. And that clarity and understanding is very important for a patient to understand. Cancer is a simple disease. Cancer is actually a very simple disease. So I have made a statement, and the statement read like this: cancer is a very simple problem. We are afraid of cancer because the present science does not understand and explain how it develops. So we panic and undergo wrong management. Cancer is curable if it is within the reversible limits, and if we are able to intercept the progress of the disease at proper time with the right understanding. To cure cancer, we need to know about its real causes and need medicines which can act curatively by acting at the root of the problem, along with the judicious application of surgery. So this is exactly what we do. So if you understand it properly, cancer is a very simple problem. So our role is to make the world understand and remove the fear factor which the conventional medicine is utilizing in a very wrong treatment. If you look sincerely into today's medical scenario, today we live in a far worse scenario than Hahnemann lived. Kahneman was very much frustrated with the illogical and irrational approach of treatment happened in his time. If he sincerely look into so-called scientific approaches today, They are calling it scientific, but it is not at all scientific. It is highly irrational, with less clarity. With some in cancer, there is no clarity and understanding at all. They are just trying to remove or destroy the product of the disease only, without even understanding from where it comes. So such irrationality occupy today, and more that it is worsened by, in certain countries, they are legally prohibiting other systems of medicine even to treat a cancer patient. So in our country also, in many countries, it is happening. In India also, it may come. There are efforts for that, especially in Kerala. The Public Health Act that introduced recently is a big way in preventing us in treating many diseases that include the highly resistant bacterial infections also. That also is still listed under only allopathic management. Their treatment version that created such a scenario, still they are listing such diseases under their listing, only treatable by them. So these are the unscientific and irrational scenario exists around the world, which we need to become aware. We need to make our politicians aware and need to modify the law accordingly, not only for our sake, but for the fellow human being's sake also. Others are unaware, but we are aware and we have right tools to manage ourselves. But when legally they are preventing even for our self-management when a crisis comes. So the relationship between mind, body, and soul or vital force is the important thing. Uh, uh, of course, that is the holistic approach, and that is the fundamental basis of our treatment in the DSA methodology, and that should be the science of every system of medicine, even though the mainstream medicine today are not following this methodology. It is our duty to make the world aware about it, correct it, so that every human beings will be enjoying the right scientific approach with the right scientific understanding. So, as I already mentioned, different cancers have different root causes. Different organs are connected to different emotional states also. Even different tooth are connected to different organs, and different emotions has impact on different tooth also. So the cancer reoccurred, as we all know, the causes are never identified and destroyed. So it is very significant to understand how cancer develops in the treatment process. So, of course, it is produced by a genetic change in our genetic makeup. So it is very fundamental to understand holistically who control our genetic makeup. And in dynamic scientific approach, that fundamental perspective is very clearly explained to the patient and family, and that makes this treatment a big difference that is based on dynamic science. So the take-home message in brief is medical science need to be furthered to holistic science. Dynamic science form the scientific basis of holistic science. DSA treatment explains how cancer develops and helps in identification and rectification of its root causes from all possible dimensions. I am repeating it as a take-home message for those who are listening. And genetic group counseling is an important tool and a curative perspective in DSA treatment methodology. It is also helpful in prevention also. So we are promoting it as the best, latest, and safest natural and holistic cancer prevention, treatment, and rehabilitation methodology in the world today. So cancer is reversible through DSA methodology. So this is all general perspective of the presentation. Now, those who wish to ask any questions, you can ask me so that we can have a discussion. This is not only applicable to cancer, this is applicable to every disease, every chronic disease, every incurable diseases of present times, because there is a big shift required. And I am initiating that shift by treating one of the challenging diseases of our time, cancer, for the ordinary common man to understand, and also scientific community to take note of the need for such changes. If anybody are interested, any
Yes.
questions,
Yes,
please.
Doctor, it was really a very good session. Can you present a case from your side? Because how you manage this?
Yeah, yeah. Okay.
Yes,
For example,
yes.
okay, I can give a few. We have many testimonies in our website, so I can tell you in brief, because the most thing we look into the medication side is, of course, through homeopathic management, and that is the selection of medicine is through repertorization, and we do and my prescription method has a difference. Say I consider my Dr. Chandrasekharan of Trivandrum as my guru, and his methodology, he used a constitutional or miasmatic 200 potency or above potency as a 1 or 2 doses, followed by organ specific medicines. If left breast is affected, there are some medicines are there. If right breast is affected, there are affinity medicines are there. And there are some indications also for that. So based on that, I choose and prescribe medicines accordingly. And sometimes because of the stages and the intensity, I also give tissue remedies, also give flower medicines, also give uh, mother tinctures whenever required. So this is a judicious management. Then the most important thing, for example, right breast cancer. In right breast cancer, there is always an particular emotional state, and that is, mainly speaking, if the breast, uterus, and ovaries, the female specific organs are affected when femininity is lost in a woman or femininity is deranged. So the affinity of breast, uterus, and ovaries generally indicates deviation from feminine nature. Because today, as I told you, the corruption is very evident. And one of the most important and natural philosophy that corrupt our mind is gender equality. As we all know, men and women are different. Men and women are different genetically, physically, physiologically, biologically, and psychologically. We should understand such differences and maintain such differences to remain healthy also. So our employment opportunities are based on such gender equality, where men and women are employed without discrimination, not a discrimination, but an understanding of the life situation differences required to maintain our natural differences. So when we are employed, when a lady is employed in a decision-making tough job position, when she sincerely tries to become sincere and loyal to that job position, she unknowingly become a tougher individual. And toughness is basically not a nature of feminine nature. Femininity is softness, smoothness, flexibility, and tenderness, in my opinion and understanding. How we understand that? To understand that, we need to look into the biological function of a woman. The most important biological function that makes a woman different from man is pregnancy, childbirth, and motherhood. For a pregnant woman to develop a baby inside her body, She need to remain soft, smooth, flexible, and tender. Then only the expandability of the uterine muscles and the abdominal muscles happen to allow the growth of the baby. Then only the cervix of the uterus and the vagina dilate to give a normal birth to the baby. Today, now we look into our current scenario with comparison with the ancient or old scenario. Many of our women who are corrupted with such a global scenario of education is unable to give a normal birth because they are mostly employed and corrupted with the wrong concept and attitudes. So they unknowingly become different, deviated from their nature, and whereby their mind setup implement proportionately into the physical plane, impacting such differences in every way, making the natural, normal biological functions difficult and difficult for them. But we don't look into that area because that is the way the world is forcing us to live in such a manner. So it is high time for us to understand. And if we don't understand and correct it, the more deformities in the future happen. The thoughts of the mother during pregnancy plays a very important role in making the genetic makeup of a baby growing inside. We notice that even transgenders are developing in Kerala today. If we look back, even in our age, in our childhood, it never happened. It may be happening in a very less than 1%. But now it become evident. More and more people are developing such a mentality. It is an epigenetic change in our genes. It happened during pregnancy, but the manifestations comes only from the puberty time onwards. So a right breast cancer patient, if we look into any right breast cancer, there is one thing in common with every right breast cancer. Unresolved, especially in a woman, unresolved conflicts leading to toughness of mind with the men or authorities. For example, nuns, I am in Philippines now, I am treating nuns also. You may have never heard of nuns developing breast, uterus, or ovarian cancers. So in Philippines also I have treated many nuns with the breast cancer, uterine cancer, like that. Because this gender equality is currently spread with the Catholic Church also. So they used the Catholic Church to spread that wrong philosophy. And we are seeing even nuns are developing breast, uterus, and ovarian cancers today, and they wonder how it happens. Before there is a problem in the monastery, they seek the advice of the priest, parish priest. Or if they cannot solve it, they go to the bishop and it is resolved there. There is an authority. Now the equality perspective, they are forced to resolve their issues by themselves, and lot of troubles and crises happen. They are unable to resolve their issues. And women are being guided by physiologically by two hormones, estrogen and progesterone. They are more emotional. Their nature varies every now. Their mood varies naturally. So that is natural to them. So the fights are never resolved. And I can see it. If you look into any patient, we can see it also. So the right breast cancer I manage, we can always see these unresolved conflicts with the men or authority figures. So, but why such a scenario happens with each patient varies from situation to situation. So we need to identify that scenario and help them to rectify that also. If the rectification happens, then only a complete cure happens. If they have difficulty in understanding and accepting these changes and go on living with that, with our medicine, we will be able to correct to some extent by correcting the vital force. But as they live continuously, Even with our medication, cancer can come back if they didn't get corrected the fundamental problem. It can come back. And if they have taken chemo or chemotherapy, the immunity get lost. Such a recurrence may spread the cancer throughout the body, leading to the fourth stage, and most of them die sooner or later. So these are the, I'm just telling the right breast cancer as an example. And I have many patients. There are testimonies in our website. And the medicine management, I'm not curing with the medicine alone. That's why I'm telling this fundamental correction is the most important perspective for my management of cancer. So every disease, there is something like that. But medicine application is also important, which I treat not with any specific medicines, with the constitutional and organ-specific medicines accordingly chosen after case taking an analysis.
Yes, what you told here is the theory of new German medicine also. That's what maybe Dr. Chandrasekharan following. That's the reason why he is suggesting such things, and you are just following the same method. Anyway, Dr.
No,
Sheet,
no, 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 no,
you.
no, doctor. Dr. Chandrasekharan don't follow this
Yes,
DSA.
yes. Okay,
He
okay, okay.
prescribe the medicine prescription only I follow from him. The
Yes, yes.
medicine prescription he follows is a constitutional or miasmatic
And
200 or above potency, along with the regional or organ specific medicines also. Because I'm telling I'm not a classical homeopath
yes, yes,
prescribing single
yes,
medicine.
yes, yes. Homeopathy has different methodology of
Method
prescribing.
approach. Yeah. Yes,
Yes,
yes.
yes, Dr. Sheila, you can.
Yes.
Yes, Doctor. Very good evening, Dr. Shaji. I'm
Okay.
glad to. Okay, I have one question.
Yeah.
If a case with a malignant tumor, in the first in allopathic medicine, they will do the surgery and remove the tumor and followed by the chemotherapy and radiation. But in case of homeopathy, I am asking you, first we have to remove the lump and then homeopathic started, or there is like that, or we are not intervene the tumor as it is, we are kept it there and then giving our constitutional medicine and other medicine like that.
No, no, I appreciate surgical removal of the tumor. Because
Oh,
if you don't remove the tumor surgically, when we give our medicine, especially if it is a malignant tumor, it is dividing or multiplying not in harmony and rhythm with our natural genetic makeup. The body will consider that tumor as an enemy of the body and reject it with apoptosis and ulcerative formation. That's why those who take our treatment, homeopathic medicine, if they are not undergoing surgery, we can see that they are developing after a few months of medication, they will develop an ulcer in the breast. Even with those breast cancer patient with a strong immunity, we can see that they are the tumor is ulcerated and rejected to the exterior. That is a natural process of our strong immunity, and that is the function expected of our immunity, rejecting anything inimical to our system to the exterior. That will prevent the spread interior. But most of the allopathy doctors don't understand it in that perspective. They take it as a complication, and there is slight difficulty once ulcer formed in conducting a surgery. So we can shortcut that rejection by removing the lump or the tumor from the body. And if it is attached to the adjoining areas, even within that organ only, I even appreciate mastectomy also. And we do the mastectomy first if it is in the third stage or like that, and then do our treatment methodology. But in allopathy, before they used to do the surgery first, then they do the chemo and radiation. But now, most of the patients during after surgery, they don't do the chemo. So the pharmaceuticals now reverse the protocol. First, they do the chemo and radiation, then only they try to do the surgery. By the time most of the patient get complicated through chemo, and surgery even become difficult after that. So that is a wrong approach in my understanding, but we cannot do anything with that.
Okay. So you suggest first we have to remove the lump, then we can
Yes.
start the homeopathy. Yes.
Yes, exactly. Or we can go simultaneously, no problem.
Okay.
In the beginning. Start
Okay.
our treatment, and while taking our medicine, they can remove the tumor also.
Okay. Thank you, doctor. Thank you.
But if there is no intervention from other system of medicine, we can go ahead with the treatment with the homeopathy only, even without removing the tumor. Some cases were successful in that way also. But
Possible. I'm not rejecting that.
yes, but
It is
whenever there is such a thing comes from other side, then naturally they may have to give the same advice as you given here. Yes.
see what I am suggesting is the best option for the patient, because I notice that after taking our medicines, there will be rejection of the tumor to the outside through ulcer formation. Once the ulcer is formed, even surgery become difficult, and the healing of the ulcer takes a long time also. So it is more disturbance to the patient, and that is the reason I suggest the surgery during or initially along with our treatment also. But if the tumor is a smaller one, we can do reversal of the tumor through apoptosis through our medication also. It depends. If it is in the first degree, first stage, we can do with the medicine only. But if it is in the third stage, second stage, it can be both ways. It all depends upon a judicious management.
Yes, Dr. Avinash, go ahead. You can ask the question directly. Please ask your question. There is a
Yeah,
question in
please.
the chat box. Please
Yes,
open your video. Avinash, go ahead. Doctor, yes.
How to understand the subtle and the deeper understanding of the patient and remedy. Find out the exact symptom.
I didn't heard your question, doctor. Can you remain closer to the?
How to understand the subtle and deeper emotion of the patient and the remedy to find out similar. That was the question.
Yeah, the emotions. Each emotions are connected to each organs is developed through continuous observation of the patient. I am doing this kind of observations for almost 30 years now. So I am not yet completed all observations. The common diseases I have identified, like breast cancer, uterine cancer, ovarian cancer, liver cancer, lung cancer, kidney cancer. Common diseases I have identified, but not all types of cancers. So it is, in my opinion, one lifetime is not enough to develop the complete knowledge about the emotions connected to each organs. So we need to treat multiple patients to come to a definitive conclusion about it. But the right breast cancer, because most of the cancer I treated is breast cancer. It is very common in Philippines. I remained I spend most of the time in treating as a professional doctor in Philippines. So I treat most of cancer patients in the Philippines, and the most common cancer here is breast cancer. So most of my patients are breast cancer. So, and also uterine cancer, prostate cancer, testicular cancer. These are all how I identified causes.
Yes, Dr. Sarvi, you can speak now.
I didn't understand is it okay? The question, Dr. Avinash, how to understand the subtle and deeper emotions of the patient and remedy to find the symptom. Okay. I think by case taking only through case taking. We need to do the case taking with an understanding to understand the basic philosophy of thinking, concept, and attitude of the patient that governs the thought development in the patient, because thoughts are energy vibration that can superpose with our vital force and influence and modify its frequency, wavelength, and amplitude. And that is one of the most important miasma, our thoughts, especially our unhealthy, unnatural, negative thinking. And
Yes.
we call it miasma, but our thoughts are one of the most important miasma that exists within us, which we, when we call miasm, we fail to find it and understand it properly. But our thoughts are one most important miasma.
Yes, yes. So Dr. Selby, you can speak.
Thank you. Good evening. Thank you, Dr. SHAJI VARGHESE. It's a very
Yes.
wonderful session. And I listened this methods 2 or 3 years ago. Thank you so much. But I know that the cancer patients' treatment is very difficult our times. We have a lot of medical treatment, radiation and others. And if you take the patient, mostly we primarily the organ damage or the organ treatment, pathological homeopathic treatment, and at the same time antimiasmatic and sometimes the acute miasm, and at the same time the constitutional treatment. I know that all of them is the to get all together take a good treatment for our cancer patient, because Dr. Dario Spinelli from Switzerland said to me, the cancer treatment is very important, our homeopathic doctors, because a lot of we saw a lot of cancer patient, and later in the future we will see many cancer patients. And you explain something more technically, and thank you so much. It's wonderful your and congratulate your success, your patients. Thank you so much.
Thank you,
Danish.
doctor. Thank you,
Yes.
doctor. Actually,
Now, that's only a few minutes. I am inviting Dr. Amresh sir to say a few vote of thanks to the session.
okay,
Thank
getting it.
you.
Okay.
Thank you, Dhaneji. Everyone, namaskar and hatif congratulations, Dr. Shaji Kuditat, Vice President of IFPH, for his enlightening presentation on cancer treatment dynamic science of mind, body, and soul. Your profound insights into the holistic approach to healing and integration of mind, body, and soul have greatly enhanced our homeopathic and holistic health care. So, very thanks, Shaji Kuditat, behalf of IFPH, whole team. Very thanks. Again, presentation. Dynamic approach is the very important. There are 3 dynamic according to law of homeopathic science. Main cause of disease, dynamic. Fear, sad, insulting,
Yes.
and medicine is a dynamic. And disease sick vital force. There are 3 dynamics. Homeopathic deals. So very thanks, sir. Again, presentation. Thank you.
Yes, that is advantage of homeopathy. It's the only medicine available in the medical world which can go beyond the physical plane to influence the dynamic components of our existence to correct its deviation from the healthy state. And that is the most important advantage and scope of homeopathy in the future. We need to understand it and make confidence in it. Then only we can make others confidence. Give that confidence to others also. Thank you. Good night to all.
Thank you, Dr.
Thank
Amresh
you,
sir.
sir. Har homeopathic, har homeopathic.
Dr. Avinash
Thank you.
Dude and Dr. Serbi Postigan and Dr. Sheila and the guest of the day, Dr. Shaji Gudiyat, and those who attend the English session. Tomorrow, as you all know, we are celebrating our 2,100 days here in this Zoom, and the inauguration is a very important personality from National Homeopathy, and that is none other than Dr. Preetha Kirakutil. She is the advisor of Homeopathy, Government of India, Ministry of Ayush, and there are a lot of eminent personalities from international side are participating. Hope all of you will join the meeting tomorrow because it is a day for celebration that has never happened in the history of homeopathy. So, thank you all. Good night, and over to Dr. Mariamma Joe to moderate the Malayalam session.